Hello, my name is Temi Sope. After watching the video Needs and Challenges of Disaster, in response, I will reflect on its content by answering the question from the prompt based on what the video presented. What are the needs and challenges of the heroic phase? The video portrays the heroic phase as the immediate period during and directly after a disaster strike. This is when rescue efforts are underway and survival in the primary focus for both workers and the survivor. What are the needs? The video makes clear that disaster workers in this phase have several critical needs. First, they need clear direction and leadership. During this period, worker needs someone to coordinate or oversee efforts so they know where to go and what to do. Second, they need basic physical sustenance. It is emphasized in the video that rest, hydration, nutrition, and rotation of shifts are necessary to prevent exhaustion. Thirdly, they need emotional containment, meaning workers need to feel that someone is in charge for them that will help them managing their own anxiety while working. What are the challenges? The video also identifies several significant challenges during the heroic phase. The first is denial. The workers deny their fear, grief, and vulnerability so that they can remain functioning. Denial is a protective mechanism for the workers and survivors because it allows them to do what needs to be done. They also deny their physical limits, ignoring hunger, fatigue, and the need for rest. This denial allows them to keep functioning, to keep rescuing, to keep helping when every fiber of their being might otherwise want to shut down. However, the video warns that denial can be a significant liability because workers deny their limits. They work without stopping or recognizing when they need a break. The video also states that the accumulated denial contributes to their severity of the later crash points. Also, the emotion they push down and the physical stress they ignore do not go away but accumulate. Another major challenge the video highlights is the constant exposure to traumatic stimuli. Workers witness people who were injured and dying. They hear screams and work in an unsafe conditions. This repeated exposure, as Van der Kolk described in The Body Keeps the Score, imprints on the brain and body. Even if the worker is not consciously processing it in the moment, the body is keeping score even when the mind is in denial. The honeymoon phase and the crash point. In the honeymoon phase, this is the aftermath of a disaster, and there is an outpouring of support, community coming together, donations arrived, and there is a sense of survival and gratitude. Survivors and workers feel optimistic and connected. The media becomes available, outside aid organizations are available, and there is a sense of hope. Describing who, when, and why the crash point may occur. The who is primarily the disaster workers themselves or the survivors. When does it occur? The when is after the media leaves, when the donated supplies stop arriving, and after the outside aid organization departed. This happens, it could be weeks, it could be months after the disaster event. Even after the world has moved on to the next crisis, the workers are still there, living in the aftermath. Why does it occur? It occurs while workers are still busy and are buoyed by the gratitude of the community, as well as the presence of the outside support. After all the external bodies are gone, the denial from the heroic phase crumbles. All the emotions they thought they were suppressed, the fear, grief, and horror flooding. They realize that while the world has moved on, they have not. They were dead. They stayed. It was explained that such a moment means a letdown, where workers feel isolated, exhausted, and overwhelmed by what they've experienced. The accumulated weight of their denied emotion crashed down on them. During the disillusionment phase, fear, anger, and hopelessness can set in. The question is what type of clinical conditions may develop from the circumstances and what type of treatment is best to overcome them. The video describes the disillusionment phase as a period where fear, anger, and hopelessness can set in. And the initial optimism of the honeymoon phase is gone, replaced replaced by replaced by frustration with a slow recovery, anger at the situation, and a deep sense of hopelessness about the future. Workers feel abandoned by the very system and community that once celebrated them. Hmm. This is where the most serious psychological and spiritual damages become apparent. What type of clinical condition may develop from these circumstances? The first one is post traumatic stress disorder, PTSD. The video describes that workers becoming hypervigilant, having intrusive memories of the disasters, avoiding places or people that remind them of it, and experiencing emotional numbness. These are PTSD symptoms. Van der Kolk highlights how traumatic experience from the heroic phase, the ones denied and suppressed, become trapped in the body, leading to the symptoms. The body is now keeping the scores in full force. Secondly, major depressive disorder. The hopelessness and withdrawal shown in the video can develop into clinical depression, characterized by persistent low mood, loss of interest in activities, sleeplessness, a change in appetite, and feeling worthlessness, like limiting yourself. Another thing is substance use disorder. It was mentioned in the video that some worker may turn to alcohol or drug to relieve the emotional pain and escape intrusive memory, a maladaptive coping mechanism that creates its own set of problems. Type of treatment best to overcome them. First one, I would say, peer support program. The video emphasizes a worker talking with colleagues who share similar experiences. This normalizes their reaction, break through the isolation of break through the isolation of the disillusionment phase and allows them to process their experiences in a safe, understanding environment. Mental health professional intervention is another one. Condition like PTSD and depression, professional treatment is crucial. This includes evidence-based therapy like trauma-focused cognitive behavioral therapy and EMDR, which help process and reprocess traumatic memories so they are no longer trapped in the body and mind. Also, we have critical incident stress debriefing. This structure provides opportunity after disaster events, allowing workers to process their experience before they are entrenched. The video further emphasized that treatments must be accessible and that workers need to understand that it is important, it is crucial to seek help. I have included the following resources in my response video, which includes the video of the needs and challenges of disaster, Fundamental of Crisis Counseling, 4th edition, Treating Trauma in Christian Counseling by Jean Greek, and The Body Keeps the Score by Bessel van der Kolk. Thank you for watching.